And basically, just two topics. We're going to talk about these two: Bell Palsy versus Trigeminal Neuralgia, and how to be able to distinguish between them. Most of the time, when you see this, will be a sort of question or a case form, and you expect them to put this table for you to distinguish between the two and what to do with them. And then, so you try not to let yourself get confused by what they are. And I'll try to make it easy as much as possible. Before that, yeah, the first one, let's talk about FAST. Okay, FAST is acronym for somebody who is having stroke. Okay, and then the board will give you, they won't give you a lot of information, but few information, but some things you'll be ringing your ear telling you that they're talking about stroke rather than Bell Palsy. So FAST, you're going to see some facial droop. Okay, and you're going to see arm weakness, followed by, they're going to have some speech issue, so some slur speech. Then this one you have to worry about the time, okay, time of onset. And you see that the case or whatever question they ask you, they will be giving you clue, like I call them buzzwords that, oh, they're talking more about stroke. Somebody coming with facial droop, acute onset of arm weakness and other things. Yeah, you know that they're trying to move you towards something more dangerous rather than Bell Palsy. So that's the first thing I want you to focus about, because it's part of the differential. Like when somebody presents with this problem, you think he may have some Bell Palsy or transient ischemic attack, TIA. That one that's not having any neurological symptoms, it will tell you like the curtain is falling over their eyes. That's the buzzword for that. And you'll be able to figure out, oh, this is really true stroke, or is it Bell Palsy, or that's a transient ischemic stroke. Now, Bell Palsy. Both of these diseases is a cranial nerve problem. So you have to know your cranial nerve, 1, 2, 3, 4, 5, 6, 7, up to 12, what each of them does and what is their function. The Bell Palsy is mostly cranial nerve 7. Okay. And the 7, most of its function is a motor function. Therefore, you should expect the problem patient is going to have is motor issues most of the time. So movement issues is they're going to show wherever is located. The facial nerve is in your face. Most of the things it control, the muscles it control is in your face. Pay attention to these words the board will give you. So it's going to be one side, so unilateral. It's never both sides. It's going to be acute onset, like somebody who has stroke. Okay. Classic, like somebody is having stroke, acute onset, one-sided problem. Okay. But what is the problem? They're going to have facial droop. So they're going to have facial drooping. That is what is going to trap you. Say, oh, is this stroke or not? But it's acute onset, one-sided problem, facial drooping. This is mostly an inflammation issue. It has nothing to do with your brain. So that's what I'm looking for when I'm listening to, I'm reading the question, I'm looking, did the patient has any viral illness before? If they give it to you, yeah, they give you a clue. That is easy. Sometimes they hide it. They don't tell you. So most of them may have some viral illness, but a bunch of them are idiopathic. You don't even know anything. Idiopathic problem. There's no cause. It just happened. All of a sudden, the cranial nerve 7 is very, very irritated and is causing this stroke-like symptoms. So one side, okay, any acute onset, and the facial droop. That's what you're going to see. I told you it's a motor problem. So if the nerve is affected, it does not work, and therefore it becomes paralyzed. So you have cranial nerve 7 completely paralyzed. If it's paralyzed, then everything that he control is going to be affected. And so if I draw the individual face like that, this is his mouth, this is your eyes, and your eyelid is here like that. This, it control, the facial nerve control your eyes. The eyelid that it closes your, the muscle that closes your eyes, that's the facial nerve controlling it. Your mouth also, and your smile, all the muscles of your face. Therefore, you don't have to memorize the symptoms, but it will tell you what is going to happen. When they smile, it will be asymmetrical. It's not going to be uniform. It will be asymmetrical facial smile. That's the problem. Classic. It's like as if they have stroke. Okay? Their eyebrow doesn't move. You control. So you try to raise your eyebrow and try to frown. Yeah, you can't frown. Okay. So when they try to frown, they can't frown on that side of their body. Right? Now, you can't close your eyes because of the muscle that is so eye closure is not possible. You can close it. What does he do? It's also involved in you making tears. So you can't, no tears for you. You see the problem? That is why, based on that, you can try to like manage the patient. Tear production is decreased. And at the corner of their mouth, here, and the nose, and the lower portion, the muscle that side become weak. This is where the drooping comes from. So we call it the nasolabial fold. It become really weak. So it's weak now because of the muscle. And so this is where the drooping from their mouth comes from. They start drooping from their mouth. And they are drooling. This, don't get confused with somebody with the airway issue. A drooling, if I tell you 25-year-old with the Bell Palsy and a drooling, is not a B-sharp moment. It's not a priority patient. You should not worry about it. It's not a priority patient at all. This is normal for these people to drool because one side of the face is not working, and therefore the nasolabial fold is affected. So they're going to drool from there. Their chewing is also impaired. So chewing, is impaired. You see how these come together. But one thing they will confuse you with is these people, when you apply cold to their face, the nerve that is affected, if you apply cold pack to the face, it becomes more painful. This is the only time they have pain, but most of the time they don't have pain. It's just like paralysis, but they don't have intense pain. So the last one is very, very important. Like when you see that if you put a cold pack in your face, it's going to be painful. You tell them not to do that. So these are all the signs and symptoms you expected now. Smiling is affected. The eyebrow is affected. They can't close their eyes. They can't make some tears. They drooling from the side of their mouth, and they can't chew properly. And then, and they don't like cold in their face, cold stuff in their face. Based on that, you can treat them. Your exams is all pathophysiology. If you figure out the problem, then you know what is going on. Just make it up. I can teach them, right? What kind of teaching do you provide for this patient? Or first of all, let's do treatment. Most of the time, because it's an inflammation, remember, you know what inflammation, what medication can you use for inflammation? Classic medication used all the time. What medication? What do you think? We use it all the time for inflammation. So steroid is good for them. So we give them steroid for the inflammation. We also know that there's some evidence of viral disease infection, like if you have HSV, herpes simplex infection, you can have Bell Palsy from it, from the inflammation of the nerve. Also, any viral infection can do that. Therefore, we can give them antivirals. And the way to remember antivirals is this. Last name is VIR. That is the best way to remember them. VIR is their last name. You don't have to memorize them, but if you see a medication with the last name as VIR, that's VIR, is antiviral. So when you see a select or apply question and you see VIR there, yeah, that means that's antiviral. And you can give it to these people with the Bell Palsy. Then you tell them it can last to 3 to 6 months. It will go away. They will get a complete recovery from this problem without any issue. So that's key for them. So whatever he has last name with the VIR, anything you can remember, so far as you remember it, yeah, they can use it for it. Okay. The pharmacological aspect, in case they go there, if you give them VIR, remember antivirals can affect your bone marrow. So you can get something we call aplastic anemia. I teach, I try to like give you everything, broad overview. So they can get a aplastic anemia. What is aplastic anemia? That means your platelet is low, your red blood cell is low, and your white count is low. So when you give somebody antivirals, they can get, everything can go low, so they can get aplastic anemia to that. So this is a side way, but that's the pharmacology to know in case they ask you, you don't know what they're going to. So that's that portion of it. Okay. Now, teaching. This is very important. So we got to teach them. This is the select or apply, teaching, education, intervention. This is what they put there. The board doesn't have anything. So when you're studying, you use the pathophysiology to come up with the teaching you provide to the patient. And then out of the teaching, you can make your own question and say, oh, this is the select or apply. I can just make a table and compare the two together. And then you have the answer right there. So what kind of teaching? Just look here. The teaching is right here. This is our pathophysiology. Okay, he can close his eyes. You don't want a eye to get damaged, injury. So during the day in AM, I want you to wear glasses because I want you to see. But at night, you can put on a patch, something to cover you because you sleep. So there's no need for you to see at night. Okay, so that's what you tell the patient. This is the teaching you provide. AM, you wear glasses. Then at night, you wear a patch, right? We talk about tears. They cannot make tears, right? So what do? Artificial tears. So artificial tears to lubricate your eyes, right? So that's something you also tell them to do as much as possible. They because they're drilling, you would want them to keep on drilling, right? So I want you to chew on unaffected side. That's what I want you to chew. I want you to chew on the unaffected side. Okay, chew on unaffected side. because they're drilling and aspiration rigs, you want them to eat some soft food, okay? And take some breaks slowly, okay? When you're eating. Their food, they won't be able to eat well. So they should have like high calorie, okay? High calorie diet. Because they're going to eat small as much as possible. I told you, when you put the cold stuff in their face, they're going to be very painful. And so this is the one you tell them, avoid cold packs in their face. So if they have pain, they can use just a warm pads on their face instead of the cold one. And this is everything they will ask you about this problem. Be able to monitor them for aspiration, be able to teach them what they need to wear at night. And then they sometimes they confuse you with the patch and then and the glasses because they have to see during the day. Well, they have to wear glasses during the day, but at night they can use a patch over there. Whatever they can use to close cover their eyes is all fine. They can do that. So that's that one. Now, so that's cranial nerve 7. The trigeminal is different. It looks the same, but it's different. And this is cranial nerve 5. It's mostly sensory, so sensation. Only few motor functions, so it's mostly sensation most of the time. And it's called trigeminal because there's only 3 of it. There's 3 segments of it. So if the individual face, I know, you go one to your upper face, one to the middle, and one to the lower, where your jaw is located. So that's why it's called trigeminal. And it's a motor, it's a sensory problem. So most of these people pain is issue is pain. You should not mix it. They're going to tell you this 122 is an acute problem. It's sudden onset. And the pain is classic. They will use so many adjectives. Don't worry about it. It's not a B sharp moment. Unless if you make the diagnosis, it's going to be sharp. It's going to be an electric because you're stimulating the nerve. Electric problem, right? You feel like a shock, right? It's so severe. They'll use words to distract you, but don't fall for it. That's not a problem. That is the description because the nerve is stimulated. And it's due to just the inflammation of the nerve, but it's this one, cranial nerve 5. And it's mostly sensory. It's one side, unilateral. The same thing. It's no bilateral problem. The key is cluster. It comes on and off. So you don't know when it's going to trigger. It has a cluster presentation. There's some point you find, there's some places you go. What are the triggers? That's your key. And that is what your teaching will be based on. Washing your face, right? Chewing, because you control your teeth. It's one of the nerves. You know, if you went to the dentist before, yeah, I know most of us. That's the nerve they try to numb on the face, the maxillary portion of it, the one that goes here. That's the one. Yes, another branch called inferior alveolar. That's the one that control your chewing. So that's the one they're going to numb it. And so chewing can activate it, right? Brushing your teeth. It's the same thing. I'm touching your teeth and I'm brushing it with something, can activate it. If you yawn, yawning can do something about it. And then talking. So based on that, you can see that you can make your teaching straightforward from this. This is what is causing the problem. The nerve is supplying all this, and every time you do something about it, it's going to work. Remember, we never talk about movement of the face. It's all about sensation. You're touching something and causing sensation. And mostly sensory, sensory, sensory. So when you're looking at the selector apply, don't let them trap you. It's all sensation. So sensation always causes pain. So pain is the major issue. So how do you manage it? What do you guys think? How do you manage somebody who has trigeminal neuralgia that has pain? What is your management? So pain management, the key first thing you say is multimodal. So don't just keep yourself open, okay? Start with multimodal. That means what? Multimodal, everything under the sun that can help with the pain is what you use. So multimodal therapy. That means NSAID is okay. SSRI is okay. If you see a selected apply question and it says somebody with trigeminal neuralgia with all these pain medication, you got to select it. Unless they ask you which one is the best. But NSAID, SSRI, opioid is also another one. And then anti-epileptic. So these are the group of medication and non-steroidal. I mean, we already put a steroid. And then, so these are the group of medications that you can use. So if you see answer choice with a bunch of NSAID, yeah. If you see antidepressant as part of it, if you see opioid and anti-epileptic, yeah. So you have so many options. But number one, okay, the number one choice, the number one choice is carbamazepine, which is an anti-epileptic. So if they say which one is the best, then that's your drug of choice. So this is your drug of choice. But if they give you select or apply, you have to pick all of them. You say, which of these can you use? Yeah, you can use all of them. It's a multimodal therapy that can be applied to all of them. So don't forget that. And you expect them to go with pharmacology, like we did with the other one, carbamazepine. Biggest side effect of this medication is what? You know it, right? The biggest side effect of this medication is agranulocytosis or leukopenia. So they're going to ask you that, and you got to teach the patient about side effect of this medication and what they should watch for and the other thing. Now, this is your select or apply, teaching education. It's no brainer, right? You just look at here. It said, if you wash your face, you're triggering you're going to cause more problem. What do you say? Don't wash your face, okay? Don't. No massaging. They should avoid extreme temperature. That means hot and too cold is a problem. So they should avoid this as much as possible. They should avoid extreme temperature as much as possible. Because when you brush your teeth, it's going to hurt. I mean, you see chewing and everything, so they use Bristol toothbrush. Something that is gentle as much as possible. And then they chew on the unaffected side. As much as possible. So small a brittle toothbrush, and then they should avoid extreme, avoid cold stuff. They can also eat some soft diet also. That is very good with a high calorie. That also help these people as much as possible. That's what they're going to ask you. You can compare. You see, one is mostly pain problem. The other one is what? Sensory problem. And then they're different. They all have some pharmacological aspect of it, and they like giving you. It's part of your prioritization, because they know they can trap you. One look like a stroke, but it's not stroke. One look like a classic bad pain, but it's not a big problem. And you'll be able to, there's some pharmacological aspect of it that they can ask you, and there's non-pharmacological things you have to teach the patient and what they should look for. Okay, and so this is the short version of it, and between these two problems. And let's look at some questions on it. The intervention, teaching, education is the same thing. It's just like, what is the scenario? You intervene if they say something wrong. Okay, you teach them if you provide new initial teaching. Yeah, and so when I see those questions as the same, it's just like it depends on the scenario. If they just find out about the disease, you teach them things they should avoid. If you already taught them and they do something wrong, then that's where you intervene. That's the difference. So don't let the NCLEX confuse you. It's the same thing. So this is one example. Okay. This is a typical example. And then she's talking with the client with unilateral facial paralysis. Which of the following statement by the client will require follow-up? I don't like this question, but you have to look at the question, answer choice before. Usually I tell you guys not to look at the answer choice, but they don't tell you anything. They don't tell you whether this is a stroke patient, nothing. They just say unilateral facial paralysis. The key is, I know what they're expecting, because there's no way, if you have stroke, like I told you, that's why I start with the fast. This is all content, that's why it's very important. I know there's no way somebody with stroke will have just unilateral paralysis. They may have more than that. They may have hand weakness. You can't have just your face having stroke on your face. And so that's why this question is a little bit tricky. But as soon as you see that, you know that this is not a stroke patient. And then she's talking with the client with what? Unilateral paralysis. This is the key word. Unilateral paralysis. Which of the following statements by the client will require follow-up? Select or that apply. As the one of you asked, Gloria asked, if they say require follow-up, this is an intervention. You are intervening to whatever wrong answer that they've asked or they said. So this is it's a form of intervention question, because it requires a follow-up. Based on this, I know this is not trigeminal neuralgia, because trigeminal neuralgia, you don't have paralysis. This is the mental process you do in your mind before you look at a question. There's only two things that will cause the paralysis. Either they have true stroke, or if they have what? Bell Palsy. So this is truly a Bell Palsy question, but they don't tell you, right? So you taught them, and they're going to say something that is wrong, that you require follow-up. So which of this you think require follow-up based on what we talked about? So this is the same question. So you just have to bring your content, and then you'll be able to answer this question. So we know this is Bell Palsy. Then you tell your brain, for Bell Palsy, I'm just worried about what? Motor problem. Sensory is not an issue. I will chew food on either side of my mouth because it does not hurt. Of course, because it's not the sensory problem, it's motor. Therefore, your face, when you chew, it's not going to hurt. But if you chew on either, the keyword is either side. Okay, you can chew from either side. One will be drilling, the other one is fine. So you chew on the side that is not drilling. It's not going to hurt. This is a trap. Of course, it's not a sensory problem, so there will be no pain. But one side is going to be not working, so you're going to draw from there. I will need to use my finger to close my eyelid after instilling the eye drops. This is exactly what I told you guys about using what? A patch and the glasses. If you don't have a patch in the glasses, just close your eyes. Because when you close your eyes, it will close. It does not move. If you lift it up, it will lift. So that's why this one is good. As you prepare meal, that includes soft and high calorie. Yes, because you won't be eating frequently. So the little that you're eating, you want all the nutrition that you needed. I will place a tape on my affected eyelid before I go to sleep. This is the same as eye patch. It's okay to place a tape. I'll put ice on the affected side of my face. No, cold stuff will make you cause pain. That's why they should avoid anything on your face that will cause pain. So the right answer is 1 and 5. I think most of you get it. Any question? And that's the way to break down the answer choice. That's the way